Good evening and welcome to Game Changers with Fabian and Lyon. Glad you could join us here on this Wednesday, and we will be joined shortly by Dr. Leslie Rogers and Wayne LeSane. They are two mental health experts. So glad you could join us here today. All right, there is Wayne and waiting on Dr. Rogers to join us. Invites. Okay. All right. Hello, Dr. Rogers.
Hello, how are you?
Good, good. How are you?
Good.
Yes. Great to see y'all good-looking folks. How you doing, Wayne?
I'm good. How are you?
Good, man. Good.
Let me see how. Okay, so I am totally new to this, the Instagram sharing and things of that sort, so I'm going to just try to share the video and see if I can.
Okay.
Okay.
Yeah. Okay, so as long as they jump onto your feed, Dr. Rogers, they should be able to
Awesome.
to see the show, man. So, but first of all, I just want to say welcome, Dr. Rogers and Mr. LeSane. Thanks for making time this evening.
Thank you. Pleasure to be here.
Okay.
Absolutely. Thank you for having us.
No doubt, Dr. Rogers. And I just want to let our audience know that Dr. Rogers is a psychologist, and she deals in the mental health field. And Mr. LeSane is a sex, intimacy, and relationship coach. And we are going to talk about mental health as it relates to men. And that seems to be a conversation, Dr. Rogers, that seems to be picking up steam in the past few years, maybe less taboo than in the past. Would you agree with that?
Absolutely. More and more men are starting to talk about mental health. I mean, they're not where they should be, but more and more are starting to open platforms to have these discussions.
Yeah. And was there one moment that this happened, that men just started to step out and maybe re-examine how they were brought up, so to speak, and how they've been dealing with their mental health?
You know, I'm not pretty sure, but I will say COVID opened a lot of discussions around mental health. A lot of folks struggled a bit,
Right.
losing jobs and things of that sort. So COVID was one of those things that kind of put people out there, especially with respect to engagement in therapy and things of that sort.
Okay. And Wayne, how about yourself? What has been your experience as far as men be more vocal now about what might be hindering them?
So for me, I live out in California, so I don't know, where you got where you are, but so out here it's a little different, So they have I was going a couple of years ago. I started going to these intimate circles where they would completely be vulnerable and open about a lot of their feelings and emotions, which was amazing to me because it's something that I had never seen before. And I was like, man, in my mind, I was like, man, I wish that people of color could see this, to be a part of this, to see what this is like, to see that, you can be vulnerable. There is a space to be, open about your feelings and emotions. So then actually, right before COVID, I went to a men's circle that was black men, and it was amazing. And I saw men there crying. I saw men being vulnerable, speaking about, past traumas, early childhood traumas, relationships. And it was amazing to me just to be able to have that conversation, and no one was there, peacocking, no one was trying to shame anybody. And it was a safe space. And I was like, wow. And so when I saw that, I was like, man, there needs to be more spaces like this, which encouraged me to even start a space because of the things that I'd seen within that circle. And that was, but then COVID came, and during COVID, a lot of people were on Zoom calls. We even were doing a Zoom call, just having people come on, just talk to them about what they were going through, And so, and I think also I had went to a panel one time, a speaking panel, and it was this, and I won't say her name, it was a doctor on there. She was a black woman, and she was just talking about how a lot of women were tired of not finding emotionally available men, right? And so, and my comment was like, can we all agree that we can understand where it comes from? Comes from our childhood as boys. We tell our little boys not to cry, you know, be tough, you know, don't, you know, don't show anybody, you know, that you're scared or you're afraid or whatever. And so we never, as young men, we don't learn how to process our emotions. And I saw that within myself. So I have 4 boys, and when I saw them going through, me being a father for them, I try to show up differently so they could show up in the world differently, which I wish I would have had at their age. So that's kind of.
Yeah, no doubt. And Dr. Rogers, you're the host of Mental Health Talk, and you run a campaign, Men Suffer Too. But before we get to that, for me personally, I think it's time we really look at this adulation that we've had for the alpha male figures in our communities, look at that and see how much value that has really served us. I think it has not really served us value because, once again, as Wayne just said, we have brought up, or we've seen our children in our communities brought up to be this kind of tough guy, not show their emotions, bottle it all in, and we know at some point it's going to come out, and maybe not out in the right way. So maybe you could speak first, please.
Absolutely. But if you think about it, right, it's cultural, right? There's a cultural aspect right there and a cultural undertone. And when you talk about men, there's a lot of intersectionalities of being a man. So when you talk about how families brought up men, say in Black communities, is based on survival, right? Keeping yourself safe. So if telling your children don't cry and be a man and man up, etc., is going to keep your child safe, this is usually what men do, right? Especially in an African American community, because, you know, it's like a protective factor for some, right? But when you talk about culture, then other cultures, you know, they experience being a man differently. They see growing up in the home, there's different aspects to being a man, right? What we can say is that traditionally, you know, the man is the head of the household, right? The man takes care of the family traditionally. Even when you talk about earlier, when you talk about Men Suffer Too, even when you talk about Men Suffer Too, traditional roles in the home as a man is the caretaker, right, of the family. So if you grow up with that worldview and that mentality that the man is the head of the household, then when you grow up and something deviates from that, right, a loss of a job, for instance, right, such as COVID, a loss of a job, right, then what does that say to your manhood, right? What does that say to you as being a man? And when I talk about intersectionalities, you know, being a man, a father, a husband, you know, a brother, being so many different roles in different situations, right, it calls for different types of presentation. So it's kind of sometimes tricky and sometimes hard for men to kind of step back and say, okay, what is this traditional man? And for me, I tell everyone, each man defines defines what being a man means. It's different for every man. For every man, if I ask, and even when I used to do men group, trauma groups, when I used to ask that question, if you were to define being a man, what that meant, everyone had a different definition based on their cultural background, based on their history.
Right. And you know, Dr. Rogers, in having experts such as you and Wayne on my show for the past 2 years has really opened up my eyes as to how I grew up, my culture, my community. And now I'm looking at this kind of tough love thing that has been a mantra in communities. And I think it has not served us, especially when we're dealing with our own family members and our own boys, for example, in our families, where they're already hurting, they're already dealing with whatever adversity. And on top of that, we want to show now tough love. You got to tough it out because you know what? That's the way maybe my grandfather or my father dealt with it.
Again, you have to go back to safety. You know, what does it look like to keep your son safe? You know, safe in a world that is sometimes hard, sometimes difficult, especially for unique populations such as Black males or marginalized males and things of that sort, right? What does it look like to keep? And let me tell you, parents do what they have to do to keep their children safe, right?
Right.
Exactly. So when you talk about that, you know, it goes back to rearing. So that's why it's important now to kind of break those cycles and start doing things a little bit differently, especially when you're talking about mental health, right? And that's important, is learning how to break those cycles and do things a tad bit differently. You can still keep your children safe, right? But at the same time, you can teach them different types of safety skills to keep themselves safe as well.
Mm-hmm. So Wayne, in trying to do so, we can alienate family members and friends as well. If we say the buck stops with us now, we'll no longer be the one handing down this tradition that doesn't really serve us. So do you agree that you risk alienating loved ones now when you say, you know what, I'm not going to do what maybe uncle is doing, or as I said, my best friend even is doing, as far as continuing this way?
Oh, definitely. You know, I feel like it definitely can be scary to people around you because it's unconditioned, right? It's unlearning, right?
Mm-hmm.
You're now unlearning the things that you've learned because at one point, you know, back to, you know, to speak to what Dr. Rogers was talking about, you know, at one point it did benefit us to have to live that way because of the conditions that we lived in. But today we can still, like she said, create safety, but it just looks differently today, you know, and I think that in itself is scary for to be vulnerable in itself is scary, right? Because you don't know what the outcome can be, right? You know, putting yourself in a position now that you don't control the outcome because
Mm-hmm.
you're allowing someone to see your feelings and emotions, right? And so that in itself is new. That's a new term for us. It's a new thing. Like, you know, just to allow somebody to truly see me and hear what I have to say and speak to my hurt, right? Like, you hurt me. That's vulnerable. That's powerful at the same time because you can now speak that out loud and see and if somebody can hold, you know, if somebody can have to hold that space for you, you know, yeah, that'd be amazing, right? Because but first we have to first look within, right? And we have to have the capacity for ourselves before we can have the capacity for others. So and that's hard in itself, right? So what comes with that is self-work. And so that's kind of where, you know, I'm trying to help people just like start to look within and get that self-help, you know, within yourself, you know, to help yourself and kind of so you can show up in the world differently. And it definitely can alienate. I'm sure that my friends have changed over the years and my circles have changed. And some members of my family probably think I'm crazy because I can, you know, my kids are completely autonomous. You know, they know themselves well. They can tell you how they feel and not be ashamed about it. You know, so, you know, I think it's a benefit to us, you know, more so than a detriment.
Right.
And sometimes it's not about what the kids feel; it's about what we feel, right? When our kids go through anxiety sometimes and go through their fears, sometimes it's the parents that project themselves, project their very own feels and fears and their experiences onto the child, and then the child emulate those fears and experiences too, right? So being able to kind of self-reflect on your very own experiences and how that impacts parenting your children as well.
You
Yeah.
know, it's so funny you say that, right? Because something as simple as we can be out in the store, right, and our child running around, and we get upset at our child, and it's not because our child is acting out, it's because we're embarrassed. We don't even know how to admit that we're embarrassed that our child is being a child. Our child is not doing anything wrong, they're just being a child, but we're embarrassed. And so because we're embarrassed now, we take it out on our child. You know, and just something as simple as that, just recognizing that in itself is huge. You know, if we can start to understand those parts of ourselves.
Mm-hmm. And you know, Dr. Rogers and Wayne, another component is our church and religion, and be willing to share that space with mental health experts, educators, doctors, psychiatrists, as yourself. And I've experienced where it has been, you know, at times a little testy there, as far as, you know, just going to church, or our church leaders now willing to embrace mental health therapy as such. And what has been your experience, Dr. Rogers, in this?
Yeah, absolutely. And that's an excellent question because a lot of people have those same concerns. I think churches are starting to become more liberal with respect to speaking about mental health. You know, traditionally, when I was growing up, you know, there was no mental health. We would talk to the church, and the church was the mental health, right?
Right.
You know, and, you know, that was a deterrent from going to mental health. But if you think about it, mental health wasn't where it is today when it was when we were growing up, right? So all we had, especially in some communities, that's all we had. Our support systems were the church, right? But now when you talk about church and talk about mental health, they are starting to embrace it. Churches have evolved. You know, pastors are getting their degrees in psychology and mental health and things like that, so they can accommodate people who are struggling and who are unstable, right? I'll give you a perfect example. I remember having a patient who was in a church and asked me, you know, Dr. Rogers, can I love God? he was a deacon in a church. Can I love God and see you as a therapist? And that's an excellent question, because a lot of folks in church, you know, probably process like, you know, am I committing a sin if I step outside of the church and go to mental health, right? And my response was, is it possible that God put me in this picture to service you and give you what you need, right? So looking at things a bit differently, like kind of reprocessing things and, you know, but to answer your question, I do believe that churches are now speaking more out about mental health. You have to, because people have, you know, suicidal ideations now. You know, there's more severe mental illnesses that are prevalent now, right? You have to recognize it. You have to. Sometimes it's outside of your component that you can deal with in churches. And I think pastors are starting to create boundaries as to what they can deal with inside of the church, and letting their parish know that it's okay if you have to step outside of church and see outside counsel as well. And I think that's an excellent thing.
No doubt. That's some great advice there. And if you're just joining us here on Game Changers with Fabian Lyon, glad you could join us. We have the honor of being with Dr. Leslie Rogers. He is a psychologist. And Mr. Wayne LeSane, he is a sex, intimacy, and relationship coach. And we're talking about this mental health subject that thankfully is gaining some traction now in our communities. And we can remember years ago when it was almost taboo to even bring up somebody with mental health in your family, and just to see how he or she might have been treated. So Wayne, I'm going to ask you, for those in our circles, those men in our circles that are not willing to embrace mental health and all the virtues of it, how would you suggest us kind of getting to them, so to speak, and maybe changing their thinking?
Right. I think that the best thing we can do is be a model for them, right? They see us. They see how we show up in the world. They see how we interact with people. They see the things that how we are viewed and accepted in the world and received, right? And so through those things, they will come to you and they will be like, man, how did you get here? How did you do this? You know, it's just basically just changing the narrative, right? Rewriting the narrative. Something that was once viewed as a weakness is now, let's look at it as a strength, right? Because it takes courage to step forward and say, hey, I need help. You know, that's a lot of courage. That's nothing weak about that. And so it's just like, I truly believe that if we show up and we model what it is, other people will follow. Okay.
Dr. Rogers, anything you want to add here?
Yeah. So I will answer this question. You know, we say mental health, you know, I think people become a bit resistant when you use the word mental health, because they interchangeably use it, mental health, and they confuse that with mental illness, right? So what happens is a lot of people know that they're two different concepts, right? Mental health and mental illness. So when we talk about mental health, people say, ooh, I don't want to talk about that, right? But if you think about it, mental health is the holistic approach, you know, how we deal with life, you know, it's how we cope with life, how we get up in the morning and dress ourselves, how we go to work, how we are able to function during work, right? Mental health is taking care of ourselves, engaging in self-care, right? Mental health is going to doctor's appointments when you need to. Mental health is the whole picture. But guys, when you talk about mental illnesses are diagnosable and they're treatable. So they're different, right? Mental illness is a part of mental health. But when you think about mental health, it's everything. It's how we live, right? It's how we understand life, how we interact with each other, how we develop relationships, how we maintain relationships. It's everything. But then a component of that is mental illness, which again are diagnosable and they're treatable illnesses, right? So I think that it's important to know the difference between the two, because a lot of times, and this is a lot of folks, when you say mental illness, people shy away from it. When you say mental health, people shy away from it because they think that you're talking about mental illness, right? But that's not, you know, you're not only talking about mental illness, you're talking about everything. So when I talk about that, it's important to know the two, so that when you communicate with your children or with your loved ones, you can actually have this discussion and say, hey, listen, mental health is this. What are your thoughts about mental health, right? So that they can have an understanding of what they're even talking about, right? Without even confusing the two. I think that's very important.
No doubt. Definitely delineating between the two. Dr. Rogers, if you could speak on the Men Suffer Too campaign, what was the genesis of it? And just maybe expound on that a little bit for us, please. Thank you.
Absolutely. Thank you for asking me, because that's my baby. And I have to tell you guys, so Wayne, he's one of the spokespersons for Men Suffer Too. So I originally started with Mental Health Talk Show. And I'm a former VA psychologist, and I worked a lot with men with trauma. And it was such a rewarding experience. I worked for the VA for veterans, and I just loved the work. And I started working with men in trauma groups. And when I left the VA, was born Men Suffer Too. And I decided to put together a Men Suffer Too campaign, because I think it's important to create platforms for unique populations to come and have their voice, right? When you talk about unique populations, you mean populations that are underrepresented when you're talking about mental health. Hey, listen, when you're talking about stats, when you look at stats on sexual abuse and trauma and things of that sort, what do you see on the board all the time? Mm-hmm. Mostly stats about women, right?
Right.
Right. So if you're a man and you're looking at these stats and you don't even see you're represented in those stats, then why should you share?
Right.
Right. So being able to normalize experiences with men and being able to create platforms so that men can come out and talk about their experiences, because everybody that knows Dr. Rogers know I always say, when one man, it takes just one man to stand up, just one. And when that one stand up, others will follow, because it normalizes those experiences and it lets each other know it's okay to, to have these discussions. So Men Suffer Too is a campaign under Mental Health Talk that I developed to just that, to promote dialogue around this unique population, to come forward and talk about, these experiences and not be afraid to do so, or not feeling weak or having these negative connotations about doing so. We are, it's going into a huge campaign. I'm looking for other spokespersons. I want to have a diverse panel of men to be a spokesperson for Men Suffer Too, because we all come from unique backgrounds, right? I grew up in an African-American family. Men histories were different from a Caucasian American family or Asian American's family, right? So having a diverse group of people coming forward and talking about their experiences as being men in mental health. How was that dealt with in the home, right? Was it ignored in the home? Was it discouraged in the home? So it's really important. Men Suffer Too, I think, is a wonderful platform for men to just be them and come out and talk about these tough topics and difficult topics with each other, and creating platforms, not just within mental health talk, but amongst themselves too. Wayne said earlier that, back in California, he established, a group. And sometimes I think, we women, we have those talks, right? We can talk to each other. But sometimes men need to have support groups outside of what they have, like friends or et cetera, that's non-judgmental, and that they can see are safe spaces, so that they can come and shoot the breeze and talk and things of that sort. So Men Suffer Too, I think, is a powerful platform. Let me tell you, it's growing really rapidly. I'm really proud of what it's become. We're talking about it more. I actually own that name now, Men Suffer Too. Woo-hoo! So I'm excited about that. So yeah, it's a great platform that I'm creating, that I have created. Right.
And Dr. Rogers, when I was reading your bio and I see that you're a former intelligence analyst and employee assistance coordinator with the FBI, the first question that came to my mind was there anything in your training there that piqued your interest in what you're doing now?
Yeah, so I started out as an intelligence analyst with the counterterrorism division, and then I finished my bachelor's degree, and from there I got on with the employee assistance. I was the employee assistance coordinator for the counterterrorism division. Went on to finish my master's degree and was like, what the hell, I might as well finish my doctorate degree. But, it was such a rewarding experience, because that was, I would say, my first sense of exposure with working in the field of psychology. I had a lot of mentors within the Bureau, and I had a lot of experience around working with, agent personnel and other personnel, staff and personnel within the Bureau. And it was exposure into how we deal with adverse events and how we cope, and how sometimes we get overwhelmed, and all these different types of experiences that we go through, right? And I found that, not being cocky, I'm not at all, guys, I'm not being cocky, but I felt that I was good at it, right? You ever indulge in something that you're like, wow, I'm really good at this, right? And it feels good. Yeah. So it was something that I was not only good at, but it felt good, right? Even when I was at the VA, it just felt good. Helping people, and it was like helping others, you know, I think gave me a better sense of self as well. It helped me to understand myself as well. You know, without this Dr. Rogers hat on, I'm Leslie underneath, right? So I have to understand myself as well in order to do the job that I'm called to do. In order to be successful at it, I have to understand myself too. So the FBI was my first awakening at becoming a psychologist. Absolutely.
Wow, that is awesome. That's a great connector right there. Wayne, I want to ask you your experience with the Men Suffer Too campaign. Is there maybe one case, obviously without naming names, that where an individual really got some assistance from that campaign, that off the top of your head?
So for me, it's so many different people, right? What I've recognized for myself is that I'm able to show up in such a vulnerable way, and anybody who knows me know that talking to me one-on-one, a lot of people open up to me. We have a lot of great conversations. I think the issue is that when, you know, the people, when you leave the safe space, you go back to the people that you're around who think a certain way, and now it's hard for you to kind of, you know, it's easy to fall back into that way of thinking, or be and just kind of close up and be guarded, right? And so I know somebody who has gone through it for many years, and just in talking to me and working through some things, oh my gosh, it's like night and day. If you knew this person back then and you knew them today, it is amazing how they are able to show up in the world. You know, I feel like they used to be angry. I think they felt like they weren't worthy a lot of times, and just didn't feel like they deserved to be loved. And so, but today they know their worth. You know, they know their worth. They know who they are, and they are shining. You know, their relationship, business, they are shining just across the board. Yeah.
Oh, that's great. And Dr. Rogers, obviously, there's one thing to get counseling, but the follow-up care, because you're going back in your communities where the norm is the norm. And how important is follow-up care for these individuals that need some more counseling?
It's really important. So, okay, so counseling is on an individual basis, right? Just like you go to therapy, and it's important to know, just because you go, it's like going to therapy. Just because you go to therapy, it doesn't necessarily mean that you're going to receive a diagnosis, right? A lot of people think if they go to therapy, they're going to be diagnosed. I've seen plenty of people and didn't give a diagnosis, right? They just wanted to come in and learn coping skills on how to deal with certain things, right? Another important aspect is just because you come to therapy doesn't mean that you're going to get on medication, right? You know, so there's a lot of things that therapy myths and stigmas about therapy that, you know, are deterring factors. Follow-up is, you know, some people leave therapy and don't have to come back, right? Some people leave therapy and then have to do booster sessions or need to come back, maybe follow-up sessions, right? So therapy is geared towards an individual person. Each individual person's presentation is different. Some people come once a week, some come, you know, once a month, depending on the presentation, right? I'm a recovery-oriented psychologist, meaning that, you know, recovery is like really important as far as like stabilization and treatment. And, you know, when you talk about follow-up care, it's not always needed. It's based on an individual basis. Now, it's important when you need it. Follow-up care is really important when you need it, but not everyone needs it. People can go to therapy and then months go down the road, years go down the road, something happens and they come back. Now, when you see follow-up care, mostly is when trauma is involved. A lot of times when you deal with trauma, sometimes you'll come back for follow-up care to talk to someone. And, you know, I have this vet speak where I'm going to actually, it's in we're trying to make it HIPAA compliant so we can open doors. But it's a reintegration program for active duty military personnel that when they come home from deployment, they'll have short-term psychotherapy and community service and resources, et cetera, before they go out into the communities, right? So that's big. So, you know, that'll create a bridge before they go into communities. When you're talking about outpatient, what you're talking about, follow-up care, outpatient services, you know, people come and go as they choose. They may not need follow-up care, right? So it's based on the individual as to what therapy is tailored towards the individual's needs.
Okay.
Does that answer that question?
It sure does.
I like to add on to it if you don't mind.
Sure.
Yeah. So for me, like as well as what Dr. Leslie Rogers mentioned, I also for how I try to approach, I try to create community and create spaces, right? So because a lot of times when you are trying to show up differently, you have to surround yourself with people who kind of think like you and kind of like, you know, and kind of move like you do, so you can kind of stay in that space and grow it, right? Because as long as you continue to do the things that you were doing before, it's hard to move away from that way of thinking and that ideology. And so I try to bring people together. We hold meet and greets, and so you can kind of again meet people who kind of think like you and just more so on the same level, because it's beneficial, right? To surround yourself with people who are on the same page as you, where you can come and be yourself as your authentic self, show up, have speak freely, be vulnerable, and people are encouraging you and giving you permission to be vulnerable. It's amazing, right? You walk away feeling good, you walk away feeling energized, and then you can go take that energy back to where you're at, and you can start to share it and give it to people, and now people will be interested as well, and maybe they'll come with you next time. So now you're starting to grow the community and just build it. And so that's what it's about. It's like building a community of people who are just becoming more evolved in their way of thinking, around mental health, mental illness, emotions, all these type of things. So yeah.
Okay, no doubt. Wayne, before we go back to Dr. Rogers, and I'm going to ask you the same question, where can we find you on social media for those who might be interested in retaining your services?
Oh, yeah. So you can find me on, it's my name, Wayne LeSane, on IG. That's my Facebook. It's actually my website as well. I just use my name. All my information is there. Especially if you go to IG, it'll take you right to my webpage. So, yeah.
Okay, great. And for you, Dr. Rogers, where can we find you?
Absolutely. You can go to my 10K business card. It's meetdrleslie.com. Meet, M-E-E-T, Dr. D-R, Leslie, Leslie.com. It takes you to all of my projects, my website, magazine, everything that I have going on, Men Suffer Too. Again, Wayne LeSane is a spokesperson for Men Suffer Too, and we are still looking for more spokespeople for Men Suffer Too, because next year we're going to do a Mental Health Talk U.S. tour where we're going to hit different states and talk about mental health to include Men Suffer Too. So if you're interested, please look me up, Meet, M-E-E-T, Dr. D-R, Leslie, Leslie.com, and everything will pop up.
Okay. And congratulations on the launch of your new online magazine, Doctor.
Yeah, I'm so excited. It's my first publication after my dissertation, and it's being received really, really well. So I hope that you guys, you go to meetdrleslie.com, click on magazine. You'll see the full magazine there, and I'm trying to get it into stores, and it'll be up on Amazon for sale soon, and hopefully in Barnes and Nobles and other places. So thank you guys for all of your support. You all are amazing.
No doubt, no doubt. So I have a question that mostly yields some goals sometimes. And for you, Dr. Rogers, what's the biggest or one of the biggest misconceptions about mental health care?
I think the biggest one is that, the difference between mental health and mental illness. A lot of people get that confused, and that misconception often interferes with engagement because people confuse the two. So that's the biggest one. Another one is if I seek treatment, engagement, then I'm going to have to get on medication.
Okay.
A lot of people fear that if they seek mental health, then they're going to have to take medication. A lot of people are against taking medication, so that's not true.
Mm-hmm.
So there's several myths to mental health, but those are two that I get a lot.
Right. Okay. And Wayne, for you, what is maybe an underrated or not talked about as much thing in on that same topic, obviously, that you just maybe gleaned from dealing with other men that need mental mental care.
I think shame comes to mind. A lot
Mhm.
of shame. Like I think that a lot of men deal with shame and guilt and are afraid to talk about those things because it may make them look weaker within the eyes of other men. But I think that we all deal with it. It's just being courageous enough to admit it. So yeah, I definitely would say shame.
Shame.
And
Okay.
I would say it's okay to feel that way too. I think that those are normal reactions. You have to
Definitely.
process through that in order to, kind of change that mindset. But I think it's good to process through that shame, that guilt, and all of those negative emotions in order to reverse that thinking and change up that mindset.
Yeah.
So, I think that those are good to kind of process through how you're
Yeah.
feeling about that.
I agree, and hence me trying to help people get to tools to
Right.
start to learn how to work with those things and process those feelings and emotions.
Exactly.
Mhm. Has that been obviously one of the biggest hindrances? But if you had to say one or two hindrances to men coming forward, what would it be, Dr. Rogers?
Say it again. You were cut off. What?
Yeah, what would be the biggest roadblock or hindrance to men typically coming forward and finding out about a
Oh
mental?
yeah, absolutely. The stigma behind it.
Yeah.
I mean, let me tell you, I hold these rooms on Clubhouse. Men suffer too. And, these guys come in there and all of them say the same thing. What are people going to think about me? And, my response is oftentimes is not what people are going to think about you, is what you think about yourself.
Wow.
It's like, it's not, because I'm telling you, it's not really so much about what others think about you.
Yeah.
The bottom line is what you think about yourself. And when you say other people are going to think I'm weak, other people are going to think this, going to think that, I guarantee you that's what you think about yourself.
Right.
So you have to change that thinking, that self-talk. You have to change that negative self-talk about what you feel about yourself, right? First, because half of the time people don't even think that about you. It's not even going through their mind. It's you. It's how you're feeling about yourself because of your experiences of being a man and your, past experiences as to mental health. And that's why I often ask, how was mental health discussions had in your home? Because that's important. Because if it's not, right, then that contributes to possibly inferences about, mental health and those myths and things of that sort. And then you see it in the media too, right? So there's a lot of I can't think of the word I want to use, but reinforcements. There's a lot of reinforcements right behind thinking negative about mental health. There's a lot of reinforcements, whether you're looking at the media, whether it's in the home, whether it's at work, that don't want to talk about it. Hey, dude, listen, when I was at the FBI writing about suicide, writing about how many suicides were in law enforcement agencies, I had to take the statistics out of my paper. That was a long time ago, right? But it's hard to kind of talk about that stuff because if you talk about it, what does that say about me? And talking about from an organizational standpoint, if we say how many suicides are happening in our organization, what is that saying about us as an organization, right? So now then put it down as like on a man's level, on an individual male's level, right? If I say that I'm going through I'm going through depression, I'm going through anxiety, or I'm going through different types of mental illnesses or symptoms, then what does that say to me about me as a man? How am I going to take care of my family? How am I going to provide for my family? So these are true feelings and true thinking behind men and why they don't come forward, because what does that say about them? And those feelings, those thoughts are then internalized as being real. They're real, right?
No doubt. And you know what? I would just like to say this. This might be for another show, but Wayne and Dr. Rogers, men hear too much of what other men think about. They might not admit it, but we overcare. Don't we overcare too much, Wayne?
I was going to mention that earlier. It's crazy because the things that we do are truly to be is sorry, the things that we do them for other men, right?
Yeah.
You know, because it's all about the pecking order, right? We want to try to be at the top, you know, because we don't want to be viewed as weaker or and all these type of things, and it sucks because we do it to ourselves, you know. And I don't think I don't think that if we it's intentional, it just is, right? It's
Right.
what we do, you know. And I was also going to say that the good thing is that you start to see these social influencers or celebrities, whatever you want to call them, starting to come out as men and talk about the things that they struggle with, you know, anxiety and mental illness, and this is helpful because again, it's there's someone modeling saying, hey, I'm dealing with this thing and I need help, and somebody else can say, oh wow, that's pretty courageous of them. I'm going through the same thing. I need help too. You know, so that's what's amazing about it. But we definitely we care way too much about what men think, and it's so funny you say that because I just remember as a kid hiding certain aspects of myself around guys because I didn't want them to know certain things about me because I was embarrassed. But today, you know, being, let's say, a nerd or whatever you want to call it is cool today, right? Those things were not cool back in the 80s, you know. And so today you can again, you have the room to be yourself more so than you had back then. So, you know, this is why these platforms are so great because now people can come forward and speak and seek the help that they need. So yes.
Yeah, absolutely. Absolutely.
Yeah, it seems we don't outgrow that part of us where, you know, it's one thing to be in the schoolyard and college and, you know, your boys and all that. But, man, 30s, 40s, 50s, man, we're still trying to impress each other for what? I don't know.
It's crazy. Oh, my gosh. Like, yeah, I see it all the time. You know, men still bragging to one another, you know, men still I've seen men hurt themselves trying to show off in front of each other, you know. So it's pretty bad.
You go to the gym, Wayne, and everybody's trying to outpress it, dude. I don't care how much your bench pressing.
It's so funny. One night, me and my friends decided they felt like they were still young again. They wanted to race. And, oh my God, it ended horribly. Yeah, I'm talking about trips to the hospital, several of them. Yeah, oh my God, it was bad.
But you're going to start seeing more. I predict you're going to start seeing more and more men come forward about mental health, especially with the platforms that's being created and with men, especially celebrities, getting up, speaking, saying, "Hey, listen, look at the sports. Simone Biles and Naomi, you know." Soccer coming forward and talking, and then other people following suit, right? So you're going to start seeing more and more men come forward to talk about because it's normalizing their experiences, and now they're hearing, hey, wait a minute, I'm not the only one. Other people are experiences or have experienced what I've gone through, so it's okay for me to speak up. But we need more and more men to come forward and speak up so that they'll know it's okay, and so that they can tell other men, it's okay, you're not alone in this place or in these spaces, right? It's going to take a lot more of that, but you're going to see it more often.
Yeah, and to me, Dr. Rogers, to be honest, I see a double standard. And for example, how Black athletes are treated, or whether it's Simone or Serena or Naomi, as far as coming out and speaking on it. And I don't feel they got nearly the support that they deserved.
Right.
It's as if our tolerance should be much higher than other people. And that is something that really, really came to the fore for me.
Yeah. So I just interviewed, and that show is going to air soon. Fabian Raphael, she's a former athlete. And, you know, she touched on that a little bit about, you know, sports performance and, you know, two girls and mental health and things of that sort. And absolutely, right. You know, I think that, you know, when you get into a certain limelight, you know, you're seen as being invincible, or you become this role model, and it becomes a bit of unrealistic, you know, that you're supposed to always be on top of your game, right? But in all actuality, none of us can really be on top of our game all the time, right? So what happens when you get that high up, right? That high up of a status, and you start to experience mental health problems, you're criticized for it because you're not supposed to, right? You're supposed to be, you know, have it all together. It's almost like you're no longer human, right? When you get to a certain place, when you're a celebrity. So, and that's why it's good for people to come out and start talking about this, because believe it or not, they open the doors for a lot of athletes to come forward and say that I'm struggling, right? And they got that discussion talking. And that's where it is. Even with this platform of Men Suffer Too, the idea is to get the platform started, get the discussions started. Hey, it might not change overnight, but guess what? It's changing already because everybody's talking about it, right? That's where it starts, right? And so when these discussions start, then we can start brainstorming ideas as to how to tackle difficult situations like this, or difficult discussions like this, or start to tackle, like, what do we do? Come together and what do we do about it, right? We can put together resources and put together platforms and put together, you know, different types of coping strategies to deal with this. But I mean, we got to get talking and get it started, right? And not be afraid to do so, right? And that's where it is. I mean, a lot of people are afraid to talk about it because they get shut down, right? But why do you shut it down, Fabian, Wayne? Why do people shut down mental health discussions? Why?
Because it makes us feel uncomfortable.
Exactly.
Right. Because it makes you feel uncomfortable, right? And that's with anything, and not only with mental health, with other stuff too. You know, when you're in an argument and you're wrong, you walk away because it makes you feel uncomfortable.
Right.
Right. So it's about tackling situations that make you feel uncomfortable and going back, thinking about why it makes you feel uncomfortable, thinking about that underlying thing that's going on, right? And process through that so you can understand. Because what happens is when you understand why you're feeling uncomfortable, you can communicate it to others.
Right.
You can better communicate it to others, right?
And which I was going to say, a lot of times being uncomfortable allows for a lot of growth.
Right.
And people don't understand that. And if they knew that, they would allow themselves to be uncomfortable more often because it just allows for themselves to grow within that situation. You know, so yes.
Absolutely. 100%.
Wow. Just really, really enjoying this conversation here with Dr. Leslie Rogers and Wayne LeSane. Dr. Leslie Rogers is a psychologist, and she started the Men Suffer Too campaign, of which Wayne is playing a big part. And I want to ask you, Dr. Rogers, how can we provide better support for those in need of mental health support? How can we do that, whether it's a family member or a loved one or somebody in the community, even somebody at work for that matter?
Absolutely. Empower them with resources, right? Empowerment is always the strongest tool, right? Nobody wants to be told what to do, right? Nobody wants to be told what to do. So, you know, I think it's, you know, beneficial to empower people with knowledge and with tools to, you know, make that move on themselves, make the decisions themselves, but give them the tools to make the decisions, right? Give them information, awareness around, such as like if it's PTSD or if it's therapy, right? If somebody's never been in therapy about before, what's that like? You know, give them resources around therapy. You know, help them look for therapists and teach them how to look for credentials, right, behind therapists, right? There's a lot of names behind a lot of acronyms behind our names, right? So sometimes it's overwhelming, right? The PSYD, the PhD, the LCPC, et cetera, right? So, you know, empower, you know, your loved ones to kind of do research and look out there as to who's a good fit, you know, consult with people. You know, you don't have to go with the first person you see, right? And I will say, and I have to say this, because this is important, so I want everybody on this platform to listen to this, right? Not all psychologists specialize in trauma.
Okay.
Not all psychologists specialize in trauma. So it's really important that you do your due diligence and do your research when you're looking for a provider, a clinician, and you make sure they specialize in whatever it is that you're thinking you need, whether it's children. Not everybody specializes in working with kids, right? Whether it's substance use, not everybody specializes in substance use. So you need to read histories and backgrounds of these clinicians because it'll save you a lot of time, you know, in going to a psychologist or a clinician and realizing, damn, they don't specialize in trauma or they don't specialize in children. Then you have to start all over again. So do your due diligence and look for, you know, do your research and look for, look at people's backgrounds to see what they specialize in to make sure they're a good fit.
Yeah. And I would even throw in there, you know, because, you know, it can be scary,
Yeah.
just kind of think of different ways to try to, create, think outside the box.
Yeah.
Maybe go with somebody for the first time,
Mm-hmm.
kind of, hold their hand through the process,
Mm-hmm.
do the work with them, not just send them out there on their own where it can be overwhelming to them. You know what I mean? So there's many different ways to definitely get involved and help a person seek the help that they need.
Right.
I'm all about thinking outside the box and trying to figure out a way that we can make this happen.
Yeah.
We got some comments here. Just want to get to a few. Sugar Chef said, find one that you feel most comfortable with.
For sure.
That is definitely a great point. And I got a pet peeve there, Dr. Rogers, and that is that we are now self-diagnosing more than ever thanks to Google.
Oh, that's horrible. Horrible.
Dr.
Gosh,
Rogers,
I tell people, and let me tell you, I do that too, Fabian. I do that too. I self-diagnose. I tell my patients not to do it, and next thing you know, I'm doing it, and I have broken limbs and everything.
I can't.
But it's horrible. It's horrible because it gives you anxiety, and it does, And let me tell you, it's like a self-fulfilling prophecy, right? If you tell yourself enough that something's going on, your brain then tells you that it's going on, and you start to mimic those symptoms. Yeah, self-diagnoses is bad. Let me tell you, if I self-diagnose, I have everything in a DSM, and DSM is what we use to diagnose, right? But yeah, it's horrible. It's horrible. But again, we want to make sense of the world. We want to make sense of what's going on with ourselves and with loved ones, right? And by making sense, we look up, try to find answers.
Yeah.
Right? We try to find answers. But hey, listen, let the professionals do it. If you feel that you or a loved one is in need of psychiatric or psychological support, please don't be afraid to reach out. You don't have to, you can always say no. It's all up to you. You agree to everything, right? But just go to a consult. Consultations are usually free for some. Some people charge minimum fees. But, go to a consult. Make sure it's a good fit. But make sure, a lot of people go in there with their own stuff and they say, oh, this isn't a good fit. So, you have to go in there with the open mind. Right? Because a lot of times we go into these sessions thinking, oh, it's not going to work. So then we get in the way of our own treatment. Right. So you want to go in and give it an honest shot. Right. Not the first person might not be a good fit, and that's okay. Right. But when you start hopping, then maybe it's not the therapeutic process. Maybe it's you. So, so just, be mindful and, try not to. I do it too, guys. I look at the Google too and be like, what's going on with me? Am I having a heart attack? But yeah, let the professionals do the work for you guys.
Yeah.
You know what's so funny is because part of your mental health is the things that you digest, right? Through social media, internet, and all kinds of stuff. And I always tell people, be careful what you read and you look at, you watch the videos, you watch all that matters, and that all affects your mental. Right, and it's all part of the mental health, right? And so be careful of what you taking in to your body because it affects you. Just be cognizant of that.
Yeah. Let me answer this question real quick. If you observe someone you think might be having a mental issue, what might be the best approach so they don't shut down? Absolutely, that's an excellent question. Again, empower them with resources. Talk to them about how they feel about becoming engaged. Helping them find an appropriate a therapist in the area, or finding insurance companies. A lot of people don't know that insurance companies pay for therapy, right? Go through, and even if they don't have insurance, Medicaid, public assistance pays for 100% of therapy, right? Like Medicaid pays for therapy too. Empower the people. And they also have hotlines, confidential hotlines, where the people can call and they don't even know who they are. Just to get consultation without actually going to therapy, just to see if it's something you want to do. There's a lot of resources out there. And if anyone is on Clubhouse, I have a list of resources. Even here on Instagram, guys, if you look through my Instagram page, I have a phone listing on my Instagram page with every single phone number listed out for therapy, for substance use, for trauma, for depression, for suicidal thinking, everything. I have like a card listed on my Instagram page. Go on there, the person that just asked that question, go on there and look at numbers and print that out, print that page out and give it to your loved one, or if you need it or whomever, print it out and keep it by your side, because maybe that's a way to empower the person, and the person can reach out when they're ready to. But please print that out and give it to whomever you need it. It's right on my Instagram page. It's a card with all the phone numbers listed out on it. A great resource to have.
Okay. I like that. I like to add to that too.
Sure.
So by the way, I don't know if you know, so I'm in school. I'm working on my master's to become a therapist as well. And so I would add to that as well. Like, just be, don't come in with your opinion, and, come in curious, ask a lot of questions, because you don't want somebody to shut down, so just be curious, it's kind of like, just show them that you care, that you have empathy for what they're going through, so again, just ask a lot of questions, so
yeah.
All right, that's great. So Dr. Rogers, a question just popped in my mind. You're at work, you haven't been feeling yourself for a period of time now. What should I disclose to my employer that will not put me at risk? Is that something that you talk about sometimes?
Absolutely. Especially, a lot of, hey, I worked for law enforcement for 25 years, right?
Sure.
So, a lot of people are resistant, especially, depending on what your job is, right? A lot of people are afraid to go to EAP, employee assistance, and other places, right? So employee assistance is there. If your employer has an employee assistance, you don't have to tell your boss that you're going to EAP. You don't have to say anything to your boss. You can just make an appointment to go to EAP, and because of confidentiality, EAP can't even tell your boss you've come, right? So that's a resource if you have that at your place of employment, use, because that's an excellent resource, employee assistance. Or you can just call out sick, right? Sick leave, use sick leave to go become engaged outside of work. It's up to you what you want to disclose, right? But you're not obligated to disclose anything. Sick leave is sick leave, right? You can use it for whatever you like. Now you're asking, what should you disclose to your boss? If you don't want to disclose anything, don't disclose anything, right? Again, use the resources that are available either at your job, such as employee assistance. Most every job has employee assistance. Is confidential, completely confidential, where your boss wouldn't know anything, and your boss can't ask about it either.
Okay.
Or call out sick and become engaged, right? So that's up to you. It's up to you what you want to, but you don't have to disclose anything to employers.
Yeah. Also,
mental health.
I didn't want to overlook something. I just want to bring something back real quick. I thought it was great information that you gave about insurance is paying for therapists. I don't think a lot of people know that.
Yeah.
And is that, you can, your insurance will pay for you to go to therapy.
Yeah.
All you gotta do is kind of figure out who takes the insurance that you have. It's a process, but you have to get a list of therapists who accept your insurance, and then you can kind of go through the process and find you a therapist. But that yes.
Yeah. Mm-hmm.
Okay, great. Well,
Did I answer your question?
That sure did, because that is something that's always, I'm sure, in the back of employees' minds, and how much confidentiality is really in place. I mean, yeah, the laws are there, but there's still word of mouth and maybe your manager going to speak with other people. So that, that's something that still happens as well.
So let me tell you the limits to confidentiality then, since you're talking about that real quick. There are limits. Even with employee assistance, even with therapy, and they'll go over limits of confidentiality. Suicide is one, suicide ideation, right? Again, if you're talking about suicide, that doesn't mean they're going to jump up and say, oh, this person is suicidal, right? You have to do an assessment, right? And you have to determine acuity. How acute is it? How much of a risk is it, right? Sometimes people have suicidal ideations when they're subtle, where, I would be okay if I didn't wake up in the morning. Right. But they don't have an actual plan to go out and kill themselves. Right. Right. So there's no acuity. There's no acute risk. Right. But if you say, hey, Dr. Rogers or EAP, I have a bottle of pills at home that I look at every night, or I have a weapon or et cetera that I look at every night, then there's a risk there. Right. Then we talk about, what's the next step. Right. So there are limits of confidentiality to suicidal thinking. Homicidal thinking, that you're going to go and hurt someone else, child abuse, and elderly abuse, right? Suicidal thinking, homicidal thinking, child abuse, and elderly abuse. Those are mandated reporting laws. every state has mandated reporting laws, right? Everything else is confidentiality. Confidentiality laws come into place. So when you're at EAP, even if you go and say that you're abusing alcohol, a lot of people at FBI was afraid, right? In law enforcement, alcoholism is really high, right? So a lot of people are afraid to disclose that because they think they're going to lose their job. But hey, listen, you're not going to lose your job, at least at the FBI you weren't, if you get help. And that falls under confidentiality. They still can't go to the employee and say that you're abusing alcohol as long as you get help, right? What happens is if it becomes a situation where that risk, it becomes an imminent risk because you're now bearing an arm, right? A firearm. Then, you have to talk about disclosures and limits of confidentiality. But if you get help, you really don't lose your jobs unless you get help. And that's federal law for a federal agency. I don't know about state, et cetera. But confidentiality, again, those are the limits of confidentiality. Suicidal thinking, if it's an imminent risk, homicidal thinking, child abuse, and elderly abuse, right? Are limits to confidentiality. If it's a court case or something like that, there may be other stuff involved. There are, other limits to confidentiality because the court is involved, right? Or criminal cases and stuff like that. Then it's a little bit more tricky, right? So confidentiality is big, guys. And a lot of people, you're bound by it. If you're a professional, mental health professional, and you can get in a lot of trouble if you breach it. So employee assistance, I stand by it. I support it. I'm an advocate for it because it works. It's short-term counseling and referral. They don't do long-term counseling. They do short-term counseling and referral, which means that they get you what you need. They empower you to give you what you need to go into the community and get what you need, right? So it's confidential, right? So, don't be afraid to go to your employee assistance or get outside treatment because it is confidential.
Right. So I could not close the show without addressing what you touched on, Dr. Rogers, and that is the suicide rates of our young people, I believe, is, if not at an all-time high, it's pretty close from reports that I have read. And what can we do, just in a general sense, if we feel somebody in our community is on a ledge, so to speak?
Yeah. Get them the help that they need. Don't be afraid to ask that question. A lot of times we tiptoe around a question. Are you going to hurt yourself? Hey, listen, ask. Are you thinking about killing yourself? Again, we shy away from things that we're uncomfortable with, right? Yeah. But when you're talking about suicide, you can't be uncomfortable. You have to be straightforward and ask the question. Don't shy away from it. Are you thinking about killing yourself, right? And getting the person the help they need. Maybe talking a person into going to the hospital or calling 911. So, hey, listen, that's another tough one, because especially in the Black communities, we don't want to call 911.
No.
Right. So that's another topic, another barrier. That's another barrier to getting help, because we don't want to call 911. Right. But that's a tough one, because the bottom line is you want to keep the person safe, right? You want to keep the person safe, and whatever it is you have to do to keep that person safe, even with calling 911, staying there with the person or trying to calm the person down, but you want to keep yourself safe too, right? So the number one thing is getting that person the help that they need. And that's, taking them to the hospital, convincing them to go to the hospital themselves, calling 911 if you have to, again, depending on the risk, and it's not really your job to determine the risk, right? If the person is trying to kill themselves, that it's already a risk there. You don't need to determine how bad the risk is, if it's imminent risk, et cetera. You need to get them the help they need to keep them safe, and it keeps others safe. Yeah. So that's a tough one, though. I think that, when you talk about suicide, it's really tough, especially in the state that the world is in today, and the experiences that we've gone through as a nation and a culture, So it's tough, but the bottom line is you have to get the help that your loved one needs, that you need, and, trust that the system will work for them.
Right. And parents, I would just hope that you'd maybe put down the phone a little bit and have these inner
Yes.
conversations that many of us grew up on, and find out how's your day today. You
Yeah.
know, not assume because they come in happy and bouncing around that they had a
Right.
good day, but sit down, take that time, and find out really what's going on with your child.
And I will
Yeah.
say also, disclose to your kids what you feel too. Especially, with COVID, and I tell parents this all the time, kids are smart. They're really smart. And
Yeah.
you can, depending on if it's age appropriate, you can tell them that you're anxious too. Hey, listen, with COVID, even me as a psychologist, I was anxious. I was having anxiety attacks. I was anxious about catching COVID. And, I was working in a hospital setting. I was taking care of my mother. I was a caregiver. So I was anxious about bringing COVID home to my family, getting them sick. So, disclose this to your children. Hey, listen, how are you feeling at school? Because I know that I'm scared at home. I'm anxious at home. How are you feeling? Because guess what? If you're not talking to them in the home, guess what? Other kids are talking to them about it. So you need to know what they're talking to other kids about, because that contributes to anxiety potentially as well. So, have these discussions with your kids and be okay with it, and then see how you can normalize these discussions by disclosing what you're feeling as well, disclosing, the experiences that you're feeling around different topics. The kids are looking at TV. They're looking at the news. They're looking at these shootings that's happening in school.
Yep.
They're looking at everything that's going on, right? So we need to sit down with them and have these discussions like, hey, listen, did you see what happened on the news? Or have they talked about it in school? What are they saying in school? How do you feel about that? How is it making you feel? Sometimes kids have a difficult time expressing themselves verbally. They can't really, depending on what their age is, they can't really verbalize like we do. So they might verbalize like, yeah, sometimes my chest hurt or my tummy ache, like somatic symptoms, right? Or I don't feel good, or my head hurts, or, things of that sort. But, talk to them about what they're feeling so that you can kind of get an idea as to if they need to talk to someone as well, and
Yeah.
get them
And all
engaged in the community resources.
Yeah, and all these conversations are important because you start when they're a kid. It helps to start to again normalize things, and you can help to prevent later suicide or whatever situation they may get themselves into because they've started to have being able to have a space to have a conversation, and start to
Yeah.
work through some of the emotions and feelings that they're already having, process some of these things. So yeah, it's definitely I would again yes speak to them early as possible. Like start these conversations at home for sure.
Yeah.
Wow. Wow. Just some great information
Absolutely.
we got on this show. And Dr. Leslie Rogers and Wayne LeSane, I just want to thank you so much for joining us here on Game Changers. Before we go, one more time where we can find you on social media, each of you. Thank you.
Thank you.
Okay.
Yes. If you go to, again, meet MEET, Dr. Leslie, LESLIE.com, meet Dr. Leslie, LESLIE.com. All my information is on there. All of my projects. If you go to the website, click on website, there's a contact us form on there. If you'd like to become a part of our writing team in the magazine, we have different sections in there. Look at the magazine, check it out, and see if you'd like to become a part of our team. I talked about earlier, if you'd like to be a sponsor, men out there for Men Suffer Too. We're looking for a diverse group of men, if you identify as male, to join our team as a spokesperson for Men Suffer Too, because we're going to be traveling different places next year. So that contact us form on the website, mentalhealthtalk.live. And get in touch with us that way. I'd love to hear from you. And thank you again for your support. This has been an amazing, amazing journey for me. And, I'm like loving every minute of it. So thank you guys so much. Thank you, Fabian, for having me on.
Sure. And Wayne, where we can find you?
Yeah, so you can just, if you go to IG, you can find me under my name, Wayne LeSane, WayneLesane. All my information is there, my bio, everything connects to all my websites, all my different social medias, everything just right there. And again, I love spaces like this. I love to be able to come on and be able to talk about things that I definitely believe that are helpful to people and can be helpful. 15 years ago, there was these spaces didn't exist, so we kind of had to kind of figure it out ourselves. And so now that I've done a lot of work for myself and I'm going through the process of coming to therapist myself, I'm wanting to help people and show up for people and create again these spaces for people to come and just kind of like start to unpack a lot of the things that they've been carrying around for so long. So thank you, Fabian, so much for providing space for us to come in here and speak. And yes, I appreciate it.
Yeah.
Absolutely.
Okay. Well, thank you, Dr. Rogers and Wayne, not only for all that you do, but thanks for making time and for all the great work that you do in the community.
Awesome. Thank you so much.
Okay. Bye-bye. Nice having you.
Bye.